Hi, Marissa here. I'm going to go ahead and present my project to you. My project is on thyroidism, and there are two kinds of thyroidisms. There's hypo and hyperthyroidism. So I'm going to go ahead and present to you my project. So what is thyroidism? There are two kinds of thyroidism. There's hyperthyroidism and there's hypothyroidism. Hyperthyroidism refers to the activity of the thyroid gland leading to excessive synthesis of the thyroid hormones, accelerated metabolism in the peripheral tissues. The secretion of thyroid hormone is no longer under the regulatory control of the hypothalamic pituitary gland. Hypothyroidism is when the thyroid gland does not produce enough thyroid hormones to meet the needs of the body. The thyroid is underactive, the opposite of hypothyroidism, whereas the thyroid gland produces too much thyroid hormone. If the thyroxine levels are low, many of the body's functions do slow down. So that's really important. What are the causes of hyper and hypothyroidism? Causes of hyperthyroidism is injury to the thyroid gland. Some medications, it can also be hereditary, inflammation of the thyroid gland, and hormonal changes, and also damage to the pituitary gland. Causes of the hypothyroidism are definitely iodine deficiency in your diet. That plays a huge factor. Inflammatory processes of tissues of the thyroid gland, complete partial removal of the thyroid gland, and unfavorable environmental factors also to the thyroid gland. Symptoms of hyper and hypothyroidism. There are a lot of factors of hypo and hyperthyroidism. So hypothyroidism, the symptoms are unexpected weight loss, rapid or irregular heartbeat, sweating and irritability, excessive sweating, and fatigue. And fatigue is also kind of the same thing as a headache. Hypothyroidism, fatigue, lethargic, or feeling cold, delayed puberty, slow growth, hair loss, dryness, constipation, and high cholesterol does play a huge factor in the symptoms of hypothyroidism. Body symptoms of hyper and hypothyroidism, they're kind of the same things as showing the same symptoms as hyper and hypothyroidism. So for hyperthyroidism, when the thyroid gland is overactive, which is hyperthyroidism, the body's processes speed up and you may experience nervousness, anxiety, rapid heartbeat, a head tremor, excessive sweating, weight loss, sleeping problems, among other problems. Hypothyroidism can affect different systems in your body. Hypothyroidism can affect your metabolism, your mental functions, your energy level, bowel movements, and you also feel fatigue, and there may be some weight gain and cold tolerance. Forms of transmission of hypo and hyperthyroidism. Hyperthyroidism mainly comes from it being genetic. You also can get it from skinny people as well. The person I interviewed was a little bit overweight. Thyroidism was genetic in her family, and now she's very skinny. Hypothyroidism, you can also get it from Graves' disease and hyperthyroidism, enlargement of the thyroid gland, also the lack of iodine and decreased production of the TH. Thyroid gland enlarges to compensator of hormonal insufficiency. The prognosis of hyper and hypothyroidism. Hypothyroidism leads to a disease progression of gradual worsening symptoms and further metabolic endangerments. Untreated hypothyroidism can cause profound coma or death. Hyperthyroidism, usually more than 80% are cured with a single dose of radioactive iodine. That usually takes 8 to 12 weeks of the thyroid to become normal after therapy. So after you take this medication, it does take 8 to 12 weeks for it to kind of kick in your body and for it to act, to act as if your body is getting used to it. So your thyroidism will become normal after you take this medication. Treatment of hyper and hypothyroidism. Hypothyroidism, standard treatment for hypothyroidism involves daily use of synthetic thyroid hormone levothyroxine. This medication restores adequate hormone levels, reversing the signs and symptoms. Hyperthyroidism, medication, antithyroid, and medications such as methadone, it's Tepotzol, stops the thyroid from making hormones. Some of these words are kind of hard to pronounce. Positive and negative outcomes of hyper and hypothyroidism. Hyperthyroidism, a positive outcome would be taking medication. A negative outcome would be rapid heart rate, heart rhythm disorder, and a risk of a stroke. Hypothyroidism, the positive outcome would be taking the medication that is required by the doctor. A negative outcome would be mild forms of depression and can affect your mental state. Okay, so the person that I interviewed, a little bit about her and her demographics. She is 48 years old. She is a female. Her race and ethnic group is white, and she is 100% Italian. Her socioeconomic status is middle class. Her employment is Portage County Board of Developmental Disabilities, whereas she is an SSA and an eligibility specialist, which is a service support administrator. And she also works at Trumbull County Children's Services. She is an RTS, which is residential therapeutic specialist. In her education, she does have a bachelor's degree in social work. She was diagnosed with hyper and hypothyroidism in 2010, almost 2011, and diagnosed in the spring of 2012, which was in April, of Hashimoto's thyroiditis as well. They diagnosed her with Hashimoto's due to the test results being high from blood work of the antigens and the antibodies of the thyroid, and past diagnosis in her early 20s. What are the treatments that are being done? She gets irregular blood work 3 to 6 months depending on the numbers to make sure she's within range. She sees her endocrinologist twice a year and has to take thyroid medication, which is T3 and T4 MESA, which also means the same as meds, every day for the rest of her life. How does she feel about the illness and disease? She kind of got a little bit emotional when I brought this up to her. She dislikes it and how it makes her feel. She just wants to wake up and feel normal once again. She doesn't want to always be so tired despite how much sleep she gets. She also does not like being not able to do what she wants when it comes to exercising because of the inflammation and being tired some days. Having to watch everything she puts in her mouth because she doesn't know how her body is going to react, regardless of all the effort she puts into watching her weight and watching her irregular exercise. It does take a huge toll on her due to the fact that she does live in Boardman and she does drive an hour to and home from work every day. So that's a long day, and it does take a huge toll on her. How has it impacted her personally, physically, and emotionally? It has definitely impacted her personally, physically, and emotionally. Some days are better than others. She has to push herself to do everything, even to get up in the morning and to go to work daily. She says her life is like a roller coaster ride. You never know what you're going to expect each day. She says you have to try and make the best of it. How does it impact her socially? It has taken a toll on her socially. It prevents her from going places and hanging out with her friends and her kids, staying up late because she can't sleep at night, impacting mood, causing anxiety and depression. She does a lot of self-isolation. She also withdraws from people, like not answering phone calls or texts from other people. How has it impacted her financially and economically? Economically and financially, it does take a toll on her, and not just her, it takes a toll on everyone who has hyper and hypothyroidism. She says there are many days where she is tired and she can't even wake up, and she does have to take a day off work or go into work late to have time to relax. Financially, it is hard to take off because there are still obligations that you have to pay for. You have responsibilities, you have to pay for your kids. She is lucky that she works because she does have medical coverage to help with her co-payments and help with her prescriptions. Because if she didn't have medical coverage, she wouldn't be able to get the prescriptions and medications that she needs in order to treat her symptoms of hyper and hypothyroidism. Um, she is happy to this day. She is still fighting hypo and hyperthyroidism. As of right now, she's been doing really good for the past 2 months. I haven't seen any drastic change. This is my mom's best friend, so I see firsthand all the time what she goes through, and she explains her symptoms and her hormonal changes and her weight loss or weight gain and her sleep. So she's fighting it every single day. So thank you.